Hello, everybody. Welcome, welcome. We are on. Welcome to this week's episode of Weekly Dose with Dr. Uday. We are going to be talking about how to eat, sleep, move, and relax in the mindset for cancer. I have a special guest. I'm so excited. She is based in Japan. And so we're going to have some really good information for you. So I'm going to start with introductions and we're going to go right into it. So, hi, everybody. For those that don't know me, my name is Dr. Uday. I am a board certified family medicine physician. I am based in Martinsburg, West Virginia. I co-own a primary care practice, namely Apple Valley Family Medicine. I also do aesthetic medicine or aesthetics, so I provide aesthetic services. And with both modalities, my goal is to have my patients not only feeling good, but looking good. All right, so we have Dr. Minako. Did I say correctly, Abe?
Abe.
Abe. So Dr. Minako Abe, who has so graciously given us some of her time. I know you're very busy, so thank you so much for being here. I'm going to give you some information about Dr. Abe. She has a dual board certification in emergency medicine and lifestyle medicine. She's the CEO of Lifestyle Medicine Japan and vice president of the Tokyo Cancer Clinic. In addition to providing cutting edge immune cell therapies for cancer, she coaches patients and survivors in lifestyle and mindset so that they thrive and not just survive. She's a published researcher, an international speaker, and can be found at Dr. Minako on YouTube, Facebook, and Instagram. She currently lives in Tokyo, Japan, with her husband and two wonderful children. Welcome, Dr. Abe.
Thank you so much for having me, Dr. Uday. I'm really excited to be here.
Yay. So I'm going to start with, I see that your board certification is in emergency medicine and lifestyle medicine. So I'm actually very interested to know how you got into doing what you do now.
Right. I know it's a big jump from emergency medicine to oncology.
Right.
I loved working in the ER. I was an emergency medicine physician for over 15 years in New York City and in New Jersey.
Wow.
And I loved treating patients in the ER. But I realized that over the years, 80% of the patients that would come through my doors, they were coming in for things that could be potentially prevented, right? Whether it was heart disease or pneumonias or drug-related things and accidents, 80% of them could have been prevented, even like up to 40% of cancers can actually be prevented. So I realized we had to sort of start further upstream and get to patients earlier. So I became very interested in lifestyle medicine. And then I had the opportunity to move back to Japan, where I grew up when I was young. My father has a cancer clinic that we treat patients. It's not an either or type of treatment, right? We want our patients to go ahead and get the surgeries and the radiation and the chemotherapies. But, we were wondering, isn't there something that we could do more, right, to support their care? And also, my father, he came from a background of, he was a cardiothoracic open heart surgeon, which is also another big jump.
Right.
But so, he saw that and then he said, well, what can we do and he's 85 now. So, what can we do to treat the patient that is minimally invasive? So he got into, stenting and catheterizations and brought that technology back from the States. He, did his fellowship in the States and then brought that back to Japan. And he was treating patients doing that for a long time, but then he realized most of his patients in Japan, we don't have that much cardiovascular disease in Japan, but everybody was dying from cancer. So using the same logic, what can we do that is minimally invasive to treat our cancer patients, which is how we ended up going to immune cell therapy. So, it is very minimally invasive. We take a blood draw from our patients, and we extract out the immune cells and we multiply them and we train those immune cells to target your own cancer. And so just from a blood draw, we can actually create a cell therapy. We create cellular vaccines to individually use personalized medicine to support your immune system and target your cancer. So long story short, that's how I ended up back in Japan, treating patients far upstream and to try and do it in a way that's minimally invasive to the patient.
That is amazing. That is very important work because, I'm primary care, so we see it all. So that is absolutely true. So that's amazing. So great. So actually, you answered one of my questions. The other one I would ask is with you helping coaching, patients on how to, as the title says, eat, sleep, move, relax, and the mindset for
Mhm.
cancer. What are the issues, maybe unexpected issues that you see and
Mhm.
you help, your patients or clients with?
Right. So, you know, when people hear, their diagnosis, when you're
Mm-hmm.
told those three little words, you
Absolutely.
have cancer,
Yeah.
right?
Yeah.
There are very few things that change your life in that moment than a diagnosis like cancer, right?
Mm-hmm.
And I think people feel so helpless. They're consumed by fear, by uncertainty. So I think the mindset and how you approach your life, once you have the diagnosis, and hopefully before you even get there, right? You,
Mm-hmm.
I,
Yeah.
I want people to realize that there really is still a lot that you can control. Sometimes people, when they're diagnosed with a serious disease, they lose all agency, right? They're just told to get surgery here and go get their chemotherapy, their radiation, and they feel like their life is sort of consumed and it's like on this path, and they completely lose control over their health. And I'm
Mm.
sure as a primary care physician, this must be, something that you deal with a lot too. It's like people need to realize that there's so much that they can do, especially with lifestyle, especially, how they eat, how they move, how they, how much they sleep and how they relax. All that has so much to do with their general health and also especially with cancer.
Gotcha.
Yeah.
So, you've kind of set the stage for it as far as the issues that they have. So, how do you help them? And I'm pretty sure this is
Mhm.
a very broad question. So, just I guess do
Mhm.
the best you can to give us a synopsis. But yeah, how do you help them?
Yeah. So, obviously, in addition to doing the regenerative medicine work that we do using cell therapies, I see patients and I see clients and I coach them. So, I do lifestyle medicine coaching. So, where I do help them with the mindset, like facing their fears and realizing how much agency they actually have to be able to help themselves. And a lot of people have so many questions like, what
Yeah.
can I eat? What should I be eating? What should I not be eating? And a lot of them don't realize how important actually sleep and not just what they eat, but how much they sleep, how much they move, how much they exercise, and how
True.
to manage their stress and how that actually impacts your own immune system and to be able to support their care.
That's
So
so
that's
true.
basically, yeah. So that's basically what I do. It's like I do a lot of coaching. And the nice thing about that is that, even if I'm in Japan, I can coach people who are all over the world who,
Mhm.
you know,
You know what? That's true. That is
have,
absolutely
have
true.
questions.
Amazing.
Yeah.
So I think the other thing, and I'm pretty sure this would be one of the things the listeners want to hear about is, specific tips that you may have for, either um, someone that has, a new diagnosis or someone that is battling cancer. So
Mhm.
what actionable tips or steps would you recommend for them to follow to kind of get them on this path to
Absolutely.
the yeah.
So I'm just gonna, I could speak all day about this, but I'll try and constrain. But I will go through each of the eat, sleep, move, and relax, and just let your audience know,
Sure.
some actionable tips right now that they can do. So
Yes.
in terms of eat, what should you eat for an anti-cancer lifestyle?
Mhm.
The number one tip that I have is to eat real food. Not that processed food.
Mhm.
Things that our great grandparents would look at and recognize as food, and not, food like substances or things that come in boxes and packages, because those things, they were created for a long shelf life and for convenience.
Right.
But most of those foods have a lot of their nutrients stripped out of it, and also, a lot of the fiber. Like, fiber is super, super important when it comes to your immune system. So, eat natural foods. There are plenty of studies that also show that the more processed food that you eat, the higher your likelihood of getting cancer, and also, your outcomes. If you have cancer and you continue to eat a lot of processed foods, your outcomes are also not as good. So lots and lots of fruits and vegetables, and you want to eat the rainbow, right? Because all those, brilliant greens and yellows and purples, and all of those are, they're colored that way because they have different phytonutrients in it. And a lot of those nutrients, are actually cancer fighting substances, right? So like your broccolis, anything in that, broccoli family, your Brussels sprouts, kale, cabbages. So those have something called sulforaphane in it, which is an active anti-cancerous food. Your berries, right? Your dark red, cherries and strawberries, blackberries, blueberries, like all of those, they have active anti-cancerous, cancer-fighting substance in them. Even things like apples and pears, right? Your stone fruits, those also, they actually suppress. They have an anti-VEGF. It's a VEGF is a vascular growth factor. So they actually can suppress, tumors in order to grow from being like a tiny speck into getting to be a big problem. They need to grow blood vessels to them. So, some of those fruits actually have things that block those blood vessels from growing towards the tumor. So that's why food is really, really important. And so, and then fiber, right? The thing that fruits and vegetables have is plenty of fiber. And fiber isn't just great for, staying regular and moving your bowels, right? It doesn't feed us, but it feeds our gut bacteria. And our gut bacteria is super important when it comes to our immune system. So 70% of our immune system actually lies in our gut. And they've actually even had studies showing that, having a healthy gut microbacteria will predict whether or not you actually recover, and it actually will predict whether or not you certain types of chemotherapies and immunotherapies, whether or not they will work or not. So we're actually starting to check people's microbiome before starting them on certain regimens. So that's EAT in a nutshell. I know.
It's awesome. They're eating it up. So yes, please keep going.
Great. So that's EAT. Sleep. So sleep is one of those things that's really undervalued, I think. But when we sleep, that is when your immune system gets activated, right? So if you're not sleeping well, your immune system is not activated. There was even a study that showed that reducing one night of sleep from 7 hours to 5 hours actually decreases the activation of one of your immune cells called a natural killer cell, which is really important for patrolling your body and getting rid of any precancerous and cancerous cells. It decreases it to 72%, just one night, which is really scary, right? We all have sleepless nights, we all have nights that, we don't get much sleep.
Right.
So I don't want you to, freak out about it, but it just goes to show we really need to prioritize our sleep. So, and it's, and there are plenty of other studies to show that people who do a lot of night shift work, whose circadian rhythms are off, right? They actually have a higher chance of getting cancer as well. So sleep is super important. So eat, sleep, move. Exercise is another area. We think of exercise as building muscles, keeping strong bones, but it's also super, super important for your immune system. So by exercising, you actually have a much less decrease. Women who exercise regularly have a 30 to 40% chance of reduced chance of getting breast cancer, right? And if you're a breast cancer survivor, right, exercising regularly, you have like a 40 to 50% chance of reduced risk of getting a breast cancer recurrence, right? We don't have any drugs on the market that will do that for you. And yet exercise will do that for you. Exercise has been associated with a decrease in 13 different types of cancers, right?
Wow.
So it's really, really important, and everybody always wants to know, well, how much do I need to exercise, right? What is the minimum amount, right? There's no actual minimum amount, but the recommended amount is about 150 minutes per week. So that's like 20, 25 minutes a day. And it doesn't have to be like going to the gym, it can be just taking a brisk walk. And you don't have to do it all in one 20 to 30-minute chunk either. You can have like 10 minutes, a 10-minute walk before work, a 10-minute walk, after dinner, and that counts as 20 minutes of moderate exercise. So at a rate that you can still carry on a conversation.
Right. That's amazing. Okay.
So that's eat, sleep, move, and then relax. And then relax is a tough one, right? Managing stress. It just seems so, hard to quantify, because what stresses one person out is different than another. And then you think, oh, well, it's like so woo-woo. It doesn't seem like it's a real thing, but it absolutely is a real thing, right? Emotions are chemical. And when you're stressed, right, your heart rate goes up, your blood pressure goes up, you actually release hormones that impact what your stress response is, right? And it's not always bad. We need a stress response, right? So that we can, jump out of the way of an oncoming car, right? But when that stress response goes for a long time, when you have chronic stress, right, and you have like the cortisol and the adrenaline and the stress hormone is at a high level for a long period of time, that has actually shown to be detrimental to your immune system. And it really causes your immune cells not to work very well. They've done laboratory studies with animals, and they stressed out those animals. And when those animals have cancer, their cancer spreads a lot faster and tends to metastasize a lot more. So, there's actual data to show that stress is not just all in your head. It actually does impact your bodily functions and, is super important to take care of. So, how do you de-stress, right? That is super individual. It's different for you and for me. And, some people like doing puzzles is really calming. And for other people, it just makes them want to pull their hair out, right? So you really have to tailor that to what, helps you de-stress and what helps fill your cup. But the one thing that's really shown to be true for all human beings is, we evolved as creatures that depended on one another. So human connection is really, really important, particularly when you have cancer, right? So reaching out to your social network. Loneliness has actually been shown to be associated with all causes of death. Actually, not just cancer, but, you're more likely to die if you report that you're lonely. You're actually more likely to die of cancer if you're reported to be lonely. But conversely, if you feel that you have a lot of friends, a lot of support around you, you're actually less likely to die of cancer. So it actually has a physical ramifications. So definitely, take care of those human connections, reach out. I know it's hard sometimes. People feel like, oh, I'm a burden. I shouldn't, bother my friends or my family. But, on the contrary, people want to help you. People want to reach out. So don't shut off those human connections. That's super, super important for health.
Absolutely. That is amazing. So, I mean, I'm pretty sure people are taking notes. So this is really helpful. Thank you so much for breaking that down. So usually then I switch gears and I talk about, ask questions about you. So we kind of started the other way. I think the other question I usually ask, because we know about how you got into what you do. The other one is, with all the experiences that you have and the life you've lived, if you got a chance to talk to your 20-year-old self, what would you tell them?
My 20-year-old self.
Or advice. or
I would tell her, just be true to yourself, be true to your heart, be authentic, don't lose yourself. We all seem to be like running this rat race, going from high school to college to medical school to, residency. It's like, and I think, we do it with a very pure heart, with the desire to help people,
Absolutely.
and we got into this line of work because we want to care for people, but to not forget to care for yourself and to lose yourself in the process. And I think when you are comfortable in your own skin and you have that strong core of who you are, and to not lose that, because that's your driving star. That's what keeps you going, I think.
So good. So good. So how can people find you, Dr. Minako?
Okay, so I am at the Tokyo Cancer Clinic, and you can Google that. It's Tokyo Cancer Clinic, one word. It's .jp because we're in Japan. Or you can find me on my website, which is Dr. Minako, DrMinako.com. I send out sort of motivational emails every Monday, and I'm pretty active on social media, and I often will post things about different foods, and stuff that I like to eat, that I think that people who are interested in improving their health might enjoy watching. So.
Awesome. So guys, you heard it from the expert. This was so good. Thank you so much.
Thank you so much for having me.
Oh, thank you. Thank you. So you guys definitely check her out, and follow her because she has some great tips. And on the flip side, if you're looking for a primary care doctor, look us up at www.applevalleyfamilymed.com. We're accepting new patients and we would love to help. And this is what we have for you. So thank you so much for joining us. Have a good week.